Hi, my name's Jean Chambers, and we're presenting this presentation here in the RegisCollege Dental Center in the lobby. And our students are going to do a presentation for you about good home care and oral health.
Hi, we are dental hygiene students at Regis College. I'm Miranda, and we're going to talk about the importance of oral health and how to take care of your teeth properly.
Like that, and this side too, and we just do the cycle stuck like that on the chewing gum, and the other one up and down and back forward on the inside of the tooth, this side and the other side. Make sure you use the soft brush and just the up and down and put it up and do the other tooth like that. Just this one up and down, and the other side the same. After you brushing, don't forget the flossing your tooth, because this one is still stuck between of the tooth. You just put the piece of the floss and put on the middle finger like this, and make sure you put on the between of the tooth and all the way down at the gum line. And when you move to the other tooth, make sure you transfer the floss to this one. That must not transfer the bacteria like this. Make sure you do the every single one. And we have the other stuff for the dry mouth, like this one you can use at night at the bedtime, and this one for the sensitivity of the tooth anytime you like. And the fluoride for the older people too.
Yeah.
Thank you.
Okay, so now I'm going to be teaching you how to care for your dentures. So there's two different types. You can have either a partial denture, which is some teeth in your mouth, or you can have a full denture, which is the entire arch of your mouth, your upper or lower teeth. When you have your dentures in, you should make sure they fit comfortably and snugly, but not too tight. This will avoid irritation to the gums underneath. Over time, your dentures might lose their fit in their mouth and feel a little loose, and you might need to get something called a denture reline, and that's when they add a little bit more material to make the dentures fit more comfortably. Or you can use adhesives to help the dentures stick a little better. And I have a picture right here. You can use Polygrip, and that shows how you should apply it to the arch. So you can keep that in mind if your dentures feel a little loose. And when cleaning them, you should clean them every night. You should soak them in water and get a tablet that's specially made for denture cleaning. Like Polydent, they make denture cleanser, and they have little brushes and a denture bath. And you just soak them overnight. And you should know that if you're a new dentures wearer, sometimes it takes a little bit of time to wear into them. You might have some sore spots, so make sure to keep up with your dentist so you can make adjustments as needed. Lastly, I'm just going to talk about why you shouldn't wear your dentures overnight. So you can get something called denture sore mouth, which is a fungal infection that can occur when your tissues can't breathe during the night. They can appear as small red spots, or they can appear on the whole arch of your mouth, like this bottom picture right here. So make sure that you do a good job at taking care of your dentures. Make sure they're clean, take them out at night, just so calculus, which is hardened bacteria, soft bacteria, odor, staining, and food debris doesn't get caught in them. Thank you.
Hi, I'm Bailey,
I'm Brianna.
and we're going to be talking about dry mouth and nutrition.
So xerostomia, it's also known as dry mouth. What can cause it is not drinking enough fluids, sleeping with your mouth open, eating dry foods, medications, toxicity related to cancer chemotherapy, and head and neck cancer radiotherapy, aging. Xerostomia affects 30% of patients older than 65 and up to 40% of patients older than 80. It is more likely to occur in those who have an intake of more than 4 prescriptions daily. Autoimmune diseases such as syndrome, poorly fitted dentures, and systemic disease.
So some of the treatments to help xerostomia or dry mouth is lozenges you can take. There's nystatin, clotrimazole, and for more severe cases, there's fluconazole, and there's also Biotine, which you can get over the counter at a drugstore. It's just an oral rinse to help with dry mouth.
Other conditions associated with xerostomia are cystic fibrosis, Hep C, HIV and AIDS, lymphoma, poorly controlled diabetes, hormonal changes such as pregnancy and menopause, stroke, and uncontrolled hypertension.
So some negative effects of having dry mouth, there's something called thrush, and with that it's like a creamy thick paste on the inside of your mouth, and you can easily wipe it off, which will become painful. You can have mouth sores, increased plaque and tooth decay, and gum disease. And you can get angular cheilitis, which is basically just cuts around the corners of your mouth right here, which can also be very painful. And having you can have poor nutrition from having trouble chewing or swallowing, or difficulty speaking.
The foods and drinks that can cause it are crackers, toast, cookies, dry breads, dry meats, poultry, and fish, dry fruit or salty foods. And drinks that can cause it are coffee, soda, and tea.
And one food that can help with denture sore mouth is yogurt. If you eat yogurt, that can soothe your throat. And that is all we have for you today.
Thank you.
The Regis Dental Center provides affordable dental care services to Waltham and surrounding communities. It's located at 1432 Main Street, Waltham, Mass., with ample parking and is also handicap accessible. We are able to offer low-cost services and take some insurances, including Mass Health, Delta Dental, Blue Cross Blue Shield, and MetLife. If you are interested in making an appointment, you can call 781-768-7250. If you have any questions about our presentation, you can ask through this email. JeanChambers@regiscollege.edu